and I am a wash and seed specialist here at UNICEF Venezuela. On behalf of my colleagues Pedro Ogando dos Santos, Ana Guillen, Cristina Mena, and David Simon, I would like to briefly present the importance of the WashFit methodology in UNICEF's program supporting maternal and child health and nutrition services. This presentation highlights the major findings in the implementation of WashFit methodology over the past 3 years, covering almost 180 healthcare facilities across 15 states. It presents key recommendations that adjusted UNICEF's WASH response, including in emergency preparedness and response for public health events. Let me start by giving you a bit of context. Venezuela finds itself as one of the 57 countries in the world that are in a humanitarian fragile context. The country has been shaped by hyperinflation, social political tensions, the progressive collapse of public services, such as water, electricity, and public health services. All of the above are also magnified by climate change and its impacts that affect the most vulnerable people in urban and peri-urban areas. More specifically, the ongoing Venezuelan crisis has clearly affected capital and operational and maintenance investments in healthcare services, which is now down to 2% of GDP compared to 7% 10 years ago. Capital and operational and maintenance investments in water services. Nowadays, only 14% of the population reportedly have access to water, when 20 years ago it was 87%. Lack of access to water makes hand washing and environmental cleaning practices very challenging, as we all understand. So, WashFit, a risk-based management tool for healthcare facilities, played a crucial role in generating data, key evidence, and later reshaping UNICEF's implementation, fundraising, and advocacy strategies. In 2020, and due to the COVID-19 response, UNICEF decided to scale up WASH and health interventions in 176 healthcare facilities, whereof 46 were hospitals, as part of a no regrets approach. UNICEF and its partners provided key WASH supplies and generic IPC trainings. WashFit baseline surveys showed that 91% of the healthcare facilities did not have adequate access to WASH, and this gave guidance within which WASH programmatic areas would be focused on. In 2021, based on these results, UNICEF consolidated its response in these facilities for mother and child services. So the data from the WashFit helped to allocate funding to the most vulnerable facilities, prioritizing 67 healthcare facilities. Furthermore, WashFit surveys helped the WASH cluster to identify the main programmatic pillars for the interventions, which were hand washing, water access, and environmental cleaning services. This also enabled UNICEF and their partners to focus on innovations, such as solar-powered electrolytic chlorinators. In 2022, UNICEF realized the importance to reinforce sustainability of these facilities, really, and the WashFit highlighted gaps in reinforcing and strengthening the IPC committees, including operation and maintenance protocols, to give increased value to technical staff as essential workforce with, for example, psychological support. All this to obtain healthcare quality. But also, it gave data to inform the support of an outbreak in a mother and child unit. In 2022, UNICEF conducted IPC and WashFit trainings to 50 state-level governmental focal points. First time they received this update in 15 years. UNICEF is currently scaling up its program through cascading trainings and supporting the MOH in cooperation with PAHO and WHO and health clusters. So thanks to WashFit, we can see the evolution of WASH services in healthcare facilities and continuously understand what changes need to be made. As mentioned before, our programming in 2020 was mainly focusing on delivering life-saving WASH services and products. This resulted in improvements in sanitation, waste management, and cleaning services. However, now our main strategy is to reinforce capacities at healthcare facility level, especially within the IPC committees, to everyday respond, but also to prepare for future public health crises. So in conclusion, data gathered from WashFit resulted as an enabler of generating data, allowing to compare facilities' service levels, to iterative find a process to dynamically change our WASH strategy and interventions, to support staff in understanding what WASH actions have a clear impact on health services, which is a source of pride and motivation. Allocating more resources to the most vulnerable facilities to effectively respond to contingencies, and creating a coordination platform between government clusters, civil society organizations, private sectors, and communities. And thank you all for your interest. My team and I can be reached via our emails. If there are any further questions or requests for information, you're all very welcome to contact us. Thank you for all the partners that we are working with, and all of you listening. Have a great rest of the conference. Thank you and goodbye.